Welcome back to the latest episode of Taking Charge of My Cancer podcast. And I have a really great guest today. I think you guys are going to have a really thrill with this one. This is Dr. Tracey Botha. She's a highly respected board certified OBGYN with over 20 years of experience in the medical field. Her extensive background in obstetrics and gynecology has provided her with a solid foundation to explore various aspects of women's health and wellness. She is unique as a gynecologist who had as well breast cancer and mastectomy, so she has definitely another perspective there. With special interest in bioidentical hormone therapy, regenerative medicine, and peptide therapy, Dr. Botha is committed to helping her patients achieve a balanced and healthy lifestyle. She understands the importance of hormone balance in overall well-being and strives to provide individualized treatment plans that address her patients' unique needs. In addition to her focus on hormone health, Dr. Botha has a passion for aesthetic medicine and cosmetic surgery. She believes that true beauty starts from within and is dedicated to offering comprehensive care that enhances her patient's physical appearance while also promoting their inner confidence. Her approach combines medical expertise with an artistic eye, ensuring that aesthetic treatments are both effective and natural. Her holistic approach encourages patients to embrace their individual and feel empowered in their journey towards health and beauty. So thank you so much, Dr. Botha, for being here with me today.
Oh, thank you for inviting me.
Absolutely. So you want to share with us the moment that you first learned about your breast cancer diagnosis?
Yes, absolutely. It was 2 months into my journey. I'd had my mastectomy in August, and actually, I found out it was actually October. It was the first week in breast cancer month, and my friend was actually my oncologist, and I called her to find out what the biopsy results were. It had been almost 3 weeks. And she called me back and then told me on the phone. And I was in the middle of my day and I actually just went straight back into our room and kept seeing patients for the
Oh,
rest of the
wow.
day. Yeah.
Wow. So as a gynecologist, did you notice any early signs of symptoms yourself? What made you come to?
No, honestly, that's the scary part. I actually went to Dr. Yancey. Everybody knows Dr. Yancey at Music, right? She just retired. I went to her for an ultrasound of my leg because I have a history of blood clots. And Dr. Dickerson actually referred me, and Dr. Yancey saw that I hadn't had my mammogram. I was 6 months late in getting it. And then she actually did it that day. She saw something and then said that I needed to have an MRI. And it took about a month and a half to get my MRI.
Oh,
And
wow.
she kept texting me and saying, Tracey, have you had it done? Have you had it done? And I thought, we were battling with kind of getting it scheduled and authorization. So yeah,
Oh, wow.
no symptoms, all mammogram.
Wow. How did your medical background influence how to proceed with the diagnosis?
So, I definitely, as a GYN, I had a lot of patients that had the diagnosis and gone through treatment, and I'd watched different patients, go through radiation therapy, chemo, and mammograms. And I think really with the knowledge of knowing that I had a very strong history of cardiac risk and dementia was a huge part of my determining factor of rather proceeding with a mastectomy than lumpectomy. I wanted to continue with hormone therapy, and I have pretty significant scarring, I keloid. And so I knew that probably the radiation would not be great for me. I also know as an OBGYN, we're pretty crazy, time factors like getting screening done, getting scheduling, seeing doctors, because there is a little bit more care that needs to be done when you still have your breasts. And so I think that did make a big significant factor in my decision making process was just that care and seeing patients.
What surprised you most about going through the patient side of the healthcare system?
Really, I don't think much surprised me. I think I'm fortunate with being a physician and having the connections there. If something doesn't happen, like my biopsy hasn't come back, I'm like, hey, where's the biopsy result? I think it really just validated everything. We tried to get mine scheduled through our GYN office, my MRI, and after a month and a half, it wasn't scheduled. And when I was able to go and see Dr. Dickerson, she was able to get it scheduled within a week. So I think there is some, a little bit cumbersome in getting things scheduled as a GYN versus a specialist.
Got you. Was any gaps in care of communication that you noticed, even as a medical professional, like between doctors, making decisions about what type of surgery? Did you notice any gap in?
Really, no. I was very fortunate. I had a great team, and I think particularly with breast cancer, they have their boards where they discuss what they're going to be, what their, really the treatment plan is. So I didn't. I think for me, and we talked about this earlier, is more just I I woke up with pretty significant discomfort after my surgery, and I had some nerve loss and some sensory and motor um, loss. And I think for me, it was more just having that connection with physical therapy. It took 3 months to get there. So I think for me, it was more just that, but everything else really was very smooth. I was fortunate.
Okay. So you feel that maybe seeing a therapist prior to surgery and right away
Absolutely.
after surgery will make a difference?
I do think so. So I was seeing an acupuncturist. My acupuncturist noticed that I had significant lordosis and certain things that she noticed. I couldn't move my arm. And I think all of these things I thought were normal as part of the recovery process. And I think having a skilled physical therapist who knows how your body functions before and after would be ideal, because I would have been able to get there before 3 months, before deficit. So yes, for sure. I think that's fantastic that you guys do that.
Okay, perfect. How did your understanding of women's health help or complicate your experience as a breast cancer patient?
So I think that I was that patient that was probably um, making Dr. Dickinson go home and drink a glass of wine. I knew that I wanted to do hormone therapy. I am a hormone specialist, and I definitely do non-traditional medicine, and there's so much great evidence-based medicine as far as estrogen and progesterone and testosterone. So, I think that me as a patient I was probably more of a difficult patient for my providers because of my knowledge of hormone therapy.
Yeah. So what type of tools, like, we face this every day, right? I have
Mm-hmm.
who are being in hormone blockers and miserable, right? They
Right,
have no life, and a lot of
right,
them just quit after a few months or the first year because they just feel horrible. So
absolutely.
what type of tools do you have? Like, how can we, or like, what do you bring to
But
Dr. Dickerson? Like, okay, this is my reasoning behind doing this. I feel this for this reason. Like, what is your, how can patients approach their healthcare providers and kind of try to see, I really would like to try to continue with hormone replacement, or is that an option for me or not?
I think there's such a scare with regards to hormones. And I think we still have a huge community of doctors thinking that estrogen causes cancer. And I think that's the big thing. We know estriol is very safe. It doesn't stimulate beta 2 receptors, and women can use that for vaginal dryness. Testosterone is actually very encouraging. And Rebecca Glasser is a surgical oncologist who's done so much um, research on testosterone with regards to being cancer protected. And she's actually placed a pellet in an active cancer and it has shrunk. So there actually are oncologists who are okay with patients doing testosterone therapy and just not estrogen therapy. And so I have quite a few patients who we collaborate, and they allow them to do testosterone therapy, just not estrogen therapy. And they are on estrogen blockers, but they can do estriol. And just even the testosterone therapy helps a significant amount for those patients. The oncologist wrote Estrogen Matters, and he's West Coast, right? I mean, he wrote that book because his wife had breast cancer, and she suffered from all the same things that you just spoke about. And it really did significantly change his practice and his approach. So West Coast is very different than East Coast with regards to hormone therapy. And I have many patients who do consults with that particular oncologist and then come and see me as well.
Okay.
But I do think that if you're going to if you're going to do hormone therapy, you should have a mastectomy, with regards to, if you don't have a metastatic cancer, you have a small cancer and you have it removed. I mean, I do think you shouldn't be doing hormone therapy if you still have breast tissue.
Okay. Okay. Very good. And you're still feeling like totally comfortable with vaginal estrogen, right?
Well, so yes, estriol does not stimulate the beta 2 receptors at all. So all oncologists are fine with that. And it really does help with the tissue. It really does help improve tissue quality. And so I have a compound pharmacist. She's actually right across the street from me. And she makes an incredible vaginal cream that has vitamin E in it as well.
Oh,
And it's every oncologist in town is okay with them using that.
okay, that's excellent. That's very good to know.
Mm-hmm. Yeah. And then, we do have PEMF therapy, and that makes a huge difference as far as for pelvic health. It improves blood flow. So there are other things that patients who have had breast cancer can do to improve their pelvic health, and I encourage that too.
Yeah. Will you explain a little bit more in detail what you just mentioned?
Magnet therapy,
Mhm.
right? So magnet therapy, we have a chair that we sit on.
Mhm.
It stimulates muscles to contract and relax. And in that process, it improves blood flow. It also re-educates the muscles to allow that nerve muscle interaction to work better. So a lot of times women who've had mastectomies, they will have a little bit of hyperactivity, particularly the deep flap, in their pelvic floor. And so not only do they have vaginal dryness, but they have pelvic floor discomfort. And physical therapy is great for that, but it's really difficult to re-educate all the muscles within the pelvic floor. So the ones that the physical therapist can get to is great, but this actually, it stimulates all the muscles to contract and relax, and it encourages blood flow, and it really does help with incontinence and just overall well-being of our vaginas. It's actually great in men too, so it's good for incontinence.
Oh, that's amazing. Is that something that patients can just kind of get for home, or they have to go to a place to get it done?
Yeah, no, it's something that they can go and be seen by a provider. And we have it here in my office, and I'm sure that there are other providers that have it.
Got
You can get a mat that has PEMF therapy, more cellular healing, that also helps. And overall, it helps them sleep better, encourages blood flow. So yeah.
That's awesome. So had your experience as a patient changed the way that you interact with your own patients? If you look back at how you used to practice before your experience as a breast cancer patient versus now, what the change?
Yeah. So I feel like my relationships with patients are the same. I think as a provider, I look a little deeper. I remember going through residency, and I remember I had great attendings. And one of the things they said was, don't ever operate on somebody in chronic pain, and that you can't fix chronic pain. It's all supratentoric. And I remember thinking, wow. And I think for a patient now who I have axillary nerve impingement, I have significant loss of my ability to use my left hand, and I do have chronic pain. For me, I think there's a way to help patients maybe not fix that pain, but help them live with it better and treat the whole person. So I think it's helped me dive a little deeper and to look at non-traditional medicine, because really what helped me was acupuncture, scar therapy, physical therapy. What's helped me continue to work, I mean, I did change my job, and I do something completely different, which is more right arm dominant, but it has helped me find different non-traditional medicine that supports a patient's overall well-being. I do dry needling, which is essentially, I know physical therapists do that.
Yeah, I do that.
Built-in muscles, yeah, and you can do e-stim. So there was nobody that I could refer anybody to locally that did pelvic floor dry needling that I knew of. So it took me about 2 years, but I went and I now do dry needling for patients. So there were things that I saw more patients with chronic pain, and I had a lot of endometriosis patients. And I just found different things that helped me help them.
That's amazing.
So I think that's it. I realized that, I think medicine's great, but there's so much that as doctors we don't know about. And going through this helped me. I was just so fortunate that, I mean, Dita Atkins said bodies in balance. Literally, if it wasn't for her, I wouldn't have made it through COVID.
Mm-hmm.
And so it's things that helped me were just not traditional. So it's helped. That's why I do what I do now, because I'm able to bring different forms of medicine into my practice.
Great. And that's gonna be my next question. You mentioned that's I switched jobs. So what happened? What led you into going from, like
Mm-hmm.
you are and now doing what you do now, which you can speak
Yes.
about what you do now too.
Absolutely. So, I did traditional OBGYN,
Mhm.
and after it was during COVID, after about 2 or 3 years, my physician told me I had to stop because I couldn't adduct my arm. Every time I did, I would have nerve impingement, and I had weakness, and I winged my scapula. And so I had to give up delivering babies, which was really traumatizing for me. I thought I was going to be an 80-year-old delivering babies. And then robotic surgery was my passion. I was really good at that. And so I just couldn't do the traditional GYN work. And so now I have a practice where I take care of patients from the beginning to the end, which involves hormones, wellness, weight loss, and aesthetics. And so everything I do now, I don't use my left arm very much. So my left arm is more my stabling arm, and then my right arm I can probably do a pull up with. It's really strong, and so it's allowed me to just evolve, and I love what I do,
Mhm.
and it's really everything. I feel like that has led me up. Like I've always done all these different things, and now I'm able to all use in my practice. So
That's amazing. That's great that you have. Again, is the more since I've been doing this podcast has been like maybe a year and a half ago, and I'm listening to other podcasts, and I've been listening
mm-hmm,
really a lot more functional medicine. And,
mm-hmm,
and then is amazed me like every physician that I have met or that I have heard on the podcast, either my guests or listen to them, that became functional medicine. They were
yeah,
traditional or conventional physician in
right,
anesthesia, right? Either a surgeon or endocrinologist, and something happened to their life
mm-hmm,
that maybe change and do what they do now. And again, things happen for a reason. But
absolutely,
I'm so glad to have you here because it's like, oh my God, we need to find somebody because I love to hear all these people that is on the West Coast, most of them, you're right.
yes,
And then who is here in Gainesville? So I'm kind of so excited to know that you are here, and then we can
yes,
refer you patients and somebody else seeing a little bit outside the box and outside the
absolutely.
conventional medicine, which again I think is super important because a lot of patients will not be in this world. It wasn't because conventional medicine, but I think
Absolutely.
we gotta be looking outside the box too.
I think it's great to know both
Yeah.
and to be able to bring two worlds together. And there's so many things. I mean, I didn't know anything about bioidentical hormone therapy until I had a patient find it on her own. She didn't tell me for 3 years because she was worried, and I watched her body transform. I mean, it blew me away. And finally, she told me, and she was driving 2 hours to do it. And in the fourth year, she came in and she said, "Could you figure this out?" And so for me, I've had patients really come in, and I've learned through them. That's when I went and looked at the research, and I was like, gosh, there's so much evidence-based medicine around this. So it absolutely, I think everything we go through in life and my exposure to this other world has really been able to allow me to bring both worlds together.
So let's go back a little bit about this hormone balance and bioidentical hormones. So will you explain that to the audience a little bit more in line terms? So what is that?
Yeah. So bioidentical hormones really just involves hormones that look like our body's natural hormones. They're available only at compound pharmacies. And so their compound pharmacies are tightly regulated. So estradiol is our body's natural estrogen. It hits the beta 2 estradiol. And when it's in a compound form, it's more what we call micronized. So it's better absorbed. So we get better levels. Testosterone is another one. A lot of women don't realize that when we're younger, we have testosterone there, and it's very oncoprotective. Both testosterone and natural progesterone stimulate the P53 gene, which causes apoptosis to cells. So it's very much protective. And so these are all hormones that look like our body's natural hormones. Synthetic hormones, they are they don't mimic our body's natural, they're not isomers, right? So they hit the receptors and they don't necessarily unlock them. And so it's just really recognizing our natural hormones and then substituting it. So our bodies feel better and very protective.
Okay. So some women think that, oh, I'm doing hormones because no, I'm doing like birth control, right?
Yes, and that's the big no-no, right? Birth control is synthetic. So birth control actually increases proteins in our bodies that deactivate our natural testosterone. So birth control pills do make women have less muscle mass. They make women moody, and they, as a result, gain weight. And I thought the same thing. I mean, I had no idea what bioidentical hormones were. I mean, it was this whole new world. And so that's what we do as GYNs, because it does really level out hormones, but unfortunately, it also decreases testosterone. And as we age and we lose our testosterone, our inflammation increases. So all the studies, I mean, Rebecca Glasser did a study of 10 years, 10,000 women, prospective cohort study that showed a reduction in breast cancer after 2 years of therapy,
Oh, wow.
which is pretty impressive. And a lot of the studies show that after 2 years, our inflammatory markers decrease. So it is quite a wonderful thing. And that's what I encourage my patients. I tell them the data, I encourage them to look it up just like I did. And then I've been doing this long enough, for about 15 years. I've watched patients transform, and a lot of their physicians are now seeing me because they realize, oh my God, it's the same thing. Like, I watched this patient completely change and her health really transform.
That's amazing. Now, I know sometimes it's certain, like, blood values that goes with conventional medicine versus certain values that goes more in the
Yeah.
functional medicine world. So what are your thoughts
Well,
about these
I,
values?
I think the values go towards your age. And
Okay.
that's the big thing. So as providers, we look and we say, oh, you're normal. But normal is based on age. So a menopausal patient, it's normal for them to not have estrogen. And estrogen and progesterone, really, there is a therapy there that we need to make. And once we get that therapeutic value, estrogen is very cardioprotective. You know, if women start estrogen at menopause and they're on it for 10 years, their risk of vascular dementia is decreased by 85%.
Oh, wow.
Cardiovascular disease, 50%, urogenital sepsis, 60%,
Wow.
osteoporosis, 35%, and just balance is improved by 11%. And so there is a value that I do try and reach for estrogen and progesterone. Testosterone just has been shown to be super therapeutic. We just want it to get above physiologic levels, and it's different for every patient. And generally the studies show that after 2 years, the inflammation decreases. So that's not cookie cutter. That's very individualized. And typically, testosterone does not increase risks of blood clot if transdermal. So creams and pellets is what we do. You don't want to swallow testosterone. And the shot actually is highly inflammatory. So it does increase LDLs and decrease HDLs. And it dramatically increases testosterone. And so particularly with men, they shoot a ton over estrogen, and a high estrogen will make them very emotional. So then they got an estrogen blocker, and then that impacts their overall lipid panel. So creams and pellets are typically what I use, and not anything. You don't want to swallow testosterone because that will increase risks of blood clot. And I think that's the big misunderstanding, is just the difference between synthetic and bioidentical.
Is any what you advise? What's the difference one versus the other? So if I need to choose to do testosterone, is that cream versus the pellet? Like, which one would you?
It's really yeah. I prefer pellets because you get a very much more level.
Okay.
I can get people therapeutic. I know what I put in, I know what the dose is, and I can tell how they're feeling. But a lot of my patients do well on creams. Creams are probably a little bit less expensive.
Okay.
I don't do troches because their half-life is 3 to 4 hours. So they're just not going to be therapeutic for very long. So it'd be 3 to 4 hours in the morning and then they drop. Whereas the creams have a half-life of about 24 hours. And then the pellets are about every 3 months. So those are going to be more level. And so that's why I choose those.
I got you.
I mean, we don't want our hormones to be all over the place. We
Yes.
don't feel sick when they're all over the place.
Got it. Another thing I have patients come across, and I even came across myself with my actual gynecologist, is like, no, we don't test hormones, right? Like I'm menopause and I don't test hormones. And I'm like, wait
Yeah.
a minute. Like, what do you mean, like you don't test hormones? And so locally, I have a great primary care who tests
Yes.
hormones. And then it's like, I want you to test
Absolutely.
my hormones because I need to start doing something about my hormones.
Yes.
So what are your thoughts about that? Because this is what
Oh,
a lot of the
absolutely.
traditional gynecologists tell
Well,
patients.
and that's how I was. I remember watching an Oprah special and she's like, ask your gynecologist to check hormones. And I remember thinking, why? I think I mean, I've always been a physician that why would I check something if I didn't do anything about it? And I think that's the issue is we're not trained in this medicine. And so there are many providers that are going out. I mean, I went out and I was blown away. And ever since then, I've gone to non-CME related educations, and I've gone out and really educated myself. And just when you're around those other providers, like peptides are another huge thing that I've recently got involved in. And it's molecular biology. It's fixing things at the core. It is blow your mind. I mean, I feel like I'm at Disney when I go to these conferences. So I do think, you know, that GYNs, we don't know that, and it takes a lot of effort. Like I see patients, I spend a lot of time with them, and everybody's different, and so you really don't have the time if you're in a busy GYN practice to do this. I stepped my OB practice down and I really focused on hormones, and I almost saw the people in my practice before. And so I do think that's sorry, I'm moving the iPad. I do think that's a big problem, is that it takes a lot of time. And we don't have the time when you have to see 30 people in a day. Here, I see about 6 patients. So
Wow,
I'm able to spend the time with them and go through things.
that's amazing. How about, so we talk about estrogen and we talk about testosterone. How about our friend progesterone?
Oh, yes. Progesterone. Progesterone's my best friend. I call it legal Xanax, right? It's calming. And I was a person that was really, I have PMDD. I hated progesterone. Every time I ovulated, I was like, felt horrible. And part of that is resolved when you use a progesterone that's sublingual. You know, when progesterone goes to the liver, it breaks down into a metabolite that mimics our body's natural progesterone, and it does cause sedation, which helps you sleep. It stimulates a P53 gene. It downregulates estrogen by 400%. So perimenopause is one of those periods where women have estrogen all over the place. 1 month it's 800, 1 month it's 30. And so my job is to educate them so that they understand their bodies and their symptoms, and they can add progesterone to it. You know, I always tell my patients progesterone is safe in pregnancy. Micronized progesterone is safe in pregnancy. We give pregnant women progesterone, but synthetic progesterone increases blood clots and it's a teratogen. So why are we treating women with Provera when we know it increases risks of breast cancer by 27%? I don't understand it. I mean, I don't understand it. So micronized progesterone is very safe. It makes you feel wonderful, helps you sleep. It helps balance estrogen. And so perimenopause, micronized progesterone is everybody's best friend.
How about through menopause?
Oh yeah, menopause for sure.
Okay.
You know, perimenopause, you need a lot more. Menopause, I have patients anywhere between 200 and 600, depending on their needs. We're all very different. And so progesterone is very, very, very good, very protective.
So here we go. My other thing is, and that was a conversation with my gynecologist, was like, so I happen to have hysterectomy, a partial
Oh,
hysterectomy.
goodness.
I
Yes.
don't have a uterus, so but I still have in my ovaries. That's why I was kind of like eager about
Mm-hmm.
knowing like what is my hormone levels look like, and because I don't know
Mm-hmm.
my periods, I don't know when I'm in menopause.
Right.
If I don't have any symptoms, that doesn't mean I'm not in menopause. So,
Mm-hmm.
and the answer is, oh, you don't have a uterus. You don't need to be worried about progesterone.
Absolutely. And I don't understand that either. I mean, there was just a recent article about how important progesterone is. So I'm hoping things will change. But we have estrogen receptors in our breast tissue. Now, American College of Gynecology says no. That's exactly true. And that's what we are taught. But in my experience, progesterone is protective. Why not place somebody on progesterone when their estrogen's high? We know that high estrogen and low inhibin, which is when your FSH goes up, increases insulin resistance. Just adding progesterone there decreases that. Yeah. It is so protective to the body.
Yeah.
And so perimenopause, high estrogen, insulin resistance happens. You add the progesterone there, or PCOS women when they're younger. That's all we need to do is add progesterone, and they lose weight. Exactly. They lose, it's hormone balance is so essential. So I really didn't understand that. And I encourage patients to always be on progesterone, especially if they've had a hysterectomy, and especially if they're perimenopausal, because their breast tissue is getting overstimulated, and they have no testosterone. So they don't have the protection there either.
Mm-hmm. And then with progesterone, do you recommend as well in a cream or like
no
oil?
So it's progesterone is a big molecule, and it's not absorbed through the skin well. Okay. Now you can do suppositories in the vagina and it will be absorbed, but progesterone is best swallowed by a pill. Okay. Or in the mouth. I have 1 or 2 patients who have to do it per vagina. Okay. Because they're very symptomatic. Okay. And their bodies don't feel very good with progesterone, but everybody can do the sublingual. Okay. Or the little ready tabs. Okay. And so you get a better level with the dissolvable. You get double the amount than you do with the capsule. And so most patients do well on that. But the cream, it's too big a molecule, so you're not going to get a level sufficient to be protective.
Okay, that's great to know. That's excellent. Are any specific myths, and I know we already kind of talk a lot about breast cancer, but is any other myths about breast cancer that you would like to clear up?
I think the big myth is that estrogen causes breast cancer. That's huge. And particularly in the healthcare field, I have nurses that come in all the time and they're so miserable. And when I talk to them and I go through the WHI and actually what the data showed, it was the progestin arm and the estrogen arm that increased breast cancer, not the estrogen arm. And then the nurses' health study, that had the 30% fold of all-cause mortality protection. Yep. And so that's the big thing. The other thing is mammograms. I think there are a lot of people out there worried about radiation from mammograms. Yep. And honestly, mammograms are so protective. Without having my mammogram, COVID would have happened, and 2 years later, who knows what my breast cancer would have been. I was able to get it early. Mm-hmm. And so I was at a conference, and I can't remember where it was, but the attendant said, you get more cosmic radiation by flying on a plane to California and back than from a mammogram. So I just encourage women. It's not uncomfortable. Dr. Yancey, I remember her saying, looking at mammograms today is like looking underneath water with goggles compared to looking underneath water without goggles. And that blew my mind, because I remember when I first went in to become, when I was first a GYN, we would not pick up anything until we could feel it. Now we're able to pick up cancer at such an early stage that you can have it removed and have a great life expectancy. So I encourage women to get their mammograms.
That's excellent. So already kind of asking you, we already been talking a little bit about endocrine therapy as well. So how do you approach that? So were you breast cancer, estrogen, ERPR positive?
Yes, absolutely I was. And remember, a non-aggressive breast cancer is estrogen positive and progesterone positive. So, I was on testosterone therapy. I was a GYN that had a hysterectomy, so I wasn't on progesterone therapy. And I think that's huge inflammation right there, right? So I had 5 years of just being estrogen dominant without progesterone. But being on testosterone therapy, my cancer was a lower malignant potential, which was positive. And so, yes, I am on hormone therapy. And my physician knows, and she's very supportive of it. And I think if you have an oncologist and you have your provider that can work together, I do think it's possible.
Mm-hmm. Okay, that's very good. What type of like testing you do or any checkups to just make sure it's not another breast cancer developing, or how is that working with you?
So once you've had a mastectomy, you do have a little bit of breast tissue, which is 10%, and you should be able to palpate it. So you really don't do imaging after that, which I know for a lot of women is scary. I have had an MRI before, I think one of my reconstructive surgeries that I had, just as a baseline, but really I haven't had any imaging since. I just do an annual breast exam.
Okay, that's perfect. What message will you give to women listening who may putting off their screens or are afraid of getting checked? And I know you already kind of mentioned it,
Yeah.
mammogram. Besides that, is anything else, or like they're just really scared to do something, right? No, we see
I
sad
think,
in some cases that is like, why were you waiting this long?
yes. Well, and I think for women and men in particular, there's some people that really don't like seeing doctors. They feel they have white coat syndrome. They just don't like going in. And I think find a provider that you feel comfortable with. I think that's the key. I think if you have somebody who you feel comfortable with, going in and doing your screen is really easy. Getting your pap smear done, right? It's a preventable form of cervical cancer. Mammograms, it's not uncomfortable nowadays. You don't even need a prescription. So even if you don't want to go see your physician, go get your mammogram, right? You don't need to have a referral. And if you have something that feels scary, just get checked out. It's better to know and to get a workup than the stress of sitting there thinking about it. I think is way worse.
That's perfect. One thing you mentioned before, I meant to ask you this before, is the peptide. So again, in the world of all out there functional, as I'm listening, is like, oh my God, like, which way do I start with all this amount of supplements? You do hormone therapy, and then you do, things to improve your mitochondria, and then you do this to kind of keep your gut from doing leaky gut, and then you
Right.
the peptide. So
It's so much.
exactly. So what is your opinion? Like if you have, you have a limit budget and you
Mm-hmm.
go and pick three things, supplements that you feel like, man, this is going to really help on my health and it's going to help on my longevity and try to decrease my inflammation and improve my sleep, what that will be some of these things that you feel like, okay, this is kind of my top things.
Supplement. Yeah. So I don't think I would then say peptides. I would say really, I think vitamin D3 with K2 is very important. It's a hormone and definitely an antioxidant. And so I encourage my patients, all of them, to do that. It's fat soluble. And so after a meal, a B complete. So we know our B1s and our B5s are just as important. They're great for our nerves as well as our B12. So a B methylated B complete. And then the third thing is magnesium. And so magnesium is in 350 metabolic processes in our bodies, and our bodies function better with it. And so magnesium glycinate and L-threonate. And then the last thing is fatty acids, because that's good for brain health. And so really DHA 1000 milligrams. There's another new one called fatty 15 that's just discovered. And so those are the four things that I tell my patients. If you can do anything, I mean, not really even a daily vitamin, those four things are best to take and to start with. And then you can make a probiotic. I mean, I do this. I have a yogurt maker and I open up a probiotic, and I over 36 hours at 99 degrees, I make myself a yogurt probiotic that you can take that will help with your gut. And that's, you can buy a whole thing of probiotics and have that last a very long time. And so, you can do other things for gut health and not necessarily take one probiotic a day that's super expensive. You can create it in the form of a yogurt.
Oh, that's a very great idea, actually. So
Mm-hmm.
you cannot just get like the power or something like that with the
Yeah.
Probiotic.
Exactly. So I have a yogurt maker. I
Uh-huh.
get L. reuteri, Lactobacillus L. reuteri, which, is part of the small gut and the large gut. And I open up one, I put a little inulin, and I use half and half. And I make it 36 hours, 99 degrees. And I have one of those a day and amazing gut health.
Oh, that's very good to know. That's excellent.
Mm-hmm.
So what gives you hope moving forward, both personally and professionally?
I'm very fortunate. I have a great family. I have a great work family. And I feel like everything that has happened to me in life has happened for a reason. I mean, it just blows me away. I'm happy to come to work every day. I think medicine, this new medicine is just, it's incredible. And to be able to share that with patients, I just feel very fortunate in everything that I do. So that gives me hope, knowing that even though I've gone through all these things in life, I've come out on top of it and better for it.
That's amazing. And how can people contact you? And I will put those information on the show notes.
Yeah. So it's I'm at tracybotha.com, and Moy Medical Spa is my location right off of 43rd. Our phone number is 352-339-4845. And so my nurse Amanda has been with me for over 21 years. And I say that we'd say she speaks Botha, which is a talent. And so she knows me well, and she's been with me along the journey, and she takes care of everybody like family. And so that's that they contact her and she'll get them right in.
Okay, perfect. Well, that has
Yeah.
amazing information. Thank you so much for taking the time to share such a great value to my audience. I'll appreciate it.
Oh, thank you for having me.
Absolutely. You have a great evening and a great rest of your birthday.
Oh, thank you so much. Bye.
Bye.